When nurses consider all of the medications that are used to manage people's diabetes, we primarily think about all the drugs that are used to lower the blood glucose level. The oral anti-diabetic drugs, the insulins, the injectable non-insulins, those are all designed to keep the blood glucose level from getting too high, becoming hyperglycemia. But there are, of course, instances for people, especially people with diabetes, whose blood sugar is so carefully monitored. There are instances when glucose elevating drugs are required. And when we're talking about the management of diabetes, we're primarily talking about episodes of hypoglycemia, when a person's blood glucose has migrated too low and there's a need to raise the blood glucose level back toward normal. We talked about hypoglycemia also in class, and the fact that we watch for low blood glucose level. In many circumstances, it's a blood glucose level below 70 milligrams percent. Severe hypoglycemia is below about 50 milligrams percent, and how important it is to treat hypoglycemia. If it's milder, if the patient is alert, we can implement what we call the rule of 15s, where we will grab a 15 gram dose, if you want to call it that, about 4 ounces of orange juice or another rapidly absorbable source of sugar, and administer that to the patient, and then wait 15 minutes and recheck the blood glucose level. And if it isn't back up to normal, then another 15 grams of carbohydrate and wait another 15 minutes, and so on. But there are also commercial preparations of a form of dextrose or sugar of some kind that we can grab if we don't happen to have orange juice on hand, or whatever. And they come in the form of like tablets or a gel that are concentrated glucose. We can also administer a very concentrated dextrose solution intravenously, like 50% dextrose. We can, in the hospital, you will find syringes of 50% dextrose that can be injected intravenously to rapidly raise a patient's blood glucose level if necessary. And thirdly, we can also administer injections, typically intramuscularly, of glucagon, which is, a natural hormone also secreted by cells in the pancreas, not by the beta cells, but by the alpha cells. And we have been able to isolate glucagon. We can administer it. So these are indicated to give to a patient who is hypoglycemic and needs their blood glucose level normalized rapidly. Whenever you have a patient who's alert and oriented, then they can swallow the 4 ounces of orange juice, or they can take a tablet of concentrated glucose and let it dissolve inside the cheek, or take the gel, put it under their tongue. We wouldn't worry about choking so much. But if you have someone who needs very rapid intravenous or parenteral intervention, or if they're not able to take oral glucose, then the administration of the concentrated dextrose or giving the glucagon will also raise the blood glucose level. And obviously, when we're treating someone for hypoglycemia, we want to get the glucose level back to normal, but we don't want to send them into the hyperglycemia range. And so these substances, the dextrose in water, the glucagon, are given typically with a specific order or with a standing protocol that is implemented whenever we check a patient's blood glucose level and it is below 70, or for severe hypoglycemia below around 50 milligrams percent. As you might imagine, one of the most important things to bear in mind for patients is that they know how to manage hypoglycemia at home. And they're not going to be giving themselves IV injections of 50% dextrose in water. They're not probably going to be giving themselves glucagon injections, but they are um, going to keep orange juice or something on hand. And if they feel some of the signs of hypoglycemia, the early signs like sweating or feeling shaky, like they're hungry, that they need to check their blood glucose and respond by taking the 4 ounces of orange juice and rechecking their blood glucose. They could also keep glucose tablets or gel around. Family members of people with diabetes also need to know what to do. They could, in a pinch, squirt some of the gel underneath the patient's tongue, and as it and the patient, even if the patient isn't fully awake and able to drink the orange juice or something like that, and in that way, family members are prepared to help treat a loved one's hypoglycemia if the loved one isn't alert enough to be able to treat it themselves. Because as hypoglycemia goes on, late signs include coma, altered mental status, and a patient may not be able to treat their own hypoglycemia, and they will need people around them to do it for them.